Hello, I'm Marwan Abourass. Welcome to Visit Vital Pulp Therapy. During a recent seminar with the young graduate students, we discussed the different methods of managing dental pulp in teeth with deep caries lesions, or what we call them near exposures. Some use calcium hydroxide base, some use MTA, others IRM, some use GIC. However, my approach is distinct. Since the introduction of new generations of universal dentin bonding systems, I do not use any more bases or do stepwise caries removal. I do one visit vital pulp therapy. This approach is scientifically supported. It is simple, straightforward treatment. That is, if followed according to guidelines, which I will describe. It minimizes treatment time and cost. It provides an alternative for root canal treatment, an alternative which sometimes may not achieve the desired results you want due to skill or case complexity or material availability. To optimize, I use my protocol, the 4R operational diagnosis protocol, to select the case. Very important. R1 is the patient report findings. Using the patient pain profile, the patient should be asymptomatic or may display symptoms of reversible pulpitis. R2, a periapical and a bite-wing radiograph taken at 0 degree angulation should show the crown with the deep caries lesions. The pulp chamber should be dark, translucent, free from any pulp stones or calcifications or opacities. The 10 ADI, you should know about them by now, they all should be within normal limits. Now, the bite-wing radiograph is important, okay? Because I want to assess the mesial and distal, the proximal thickness of remaining dentin between caries and the pulp chamber. R3, which is response test, CPT, cold test is within normal limits, the periodontal tissue within normal limits. Okay? The most important in the 4R operational diagnosis is the R4. Endodontic treatments, including pulpectomy, pulpotomy, pulp capping, are procedures that involve both soft and hard tissues. Thus, they are surgical treatments, procedure. They're not restorative, fill and drill, or drill and fill. So the principles of asepsis, Halstead principle of infection control, asepsis, tissue management, keeping the blood supply should be observed. I will try in the following 5 steps to apply these principles to vital pulp therapy. VPT should be performed under magnification and fiber optic transillumination. The most important is asepsis. Asepsis with rubber dam isolation and control infection of the tooth surfaces and the cavity with caries continuously swapped with 2.5 sodium hypochlorite with a cotton pellet saturated. The next step is to identify 2 zones, central caries and peripheral caries. The central caries is close to the pulp chamber. The peripheral carie is close to tooth surfaces. Now, that differential is important because central caries, I would like to remove it by hand instruments. And why? Because I want to prevent accidental pulp exposure. So back in 1995, I created the design of microsurgical curettes and excavators. I call them MAR C1, C2, C3. They were produced by Hufridi Corporation. These excavators are excellent because they have extended shanks, and you could see what you are doing exactly, where the instrument is functioning. I want you to be assured I have no financial ties to this aspect whatsoever, in the past or now. So for peripheral caries removal, I use number 2 slow speed or low speed carbide burr. The key for pulp recovery is 2 millimeter thickness of RDT. Even 0.5 millimeter can do the job if you do not expose the pulp. Even if this 0.5 millimeter soft. And this is why we need fiber optic transillumination, because when you examine the area, the pulp tissue will shine through as a red or pinkish stop. If that's the case, stop excavation. Okay? Stop it. And basically, use sodium hypochlorite. Shia, in 2020, in the University of Taipei in Taiwan, demonstrated that 2.5 sodium hypochlorite in vital pulp therapy can kill over 99% of Streptococcus mutans and Enterococcus faecalis, which are the primary cause of caries and endodontic infections. The bonding system I'm talking about, they have antibacterial properties. Dr. Hardan, in 2021, showed with a systematic review of the literature that dental bonding systems have a confirmed antibacterial activity. These systems not only etch, prime, and seal dental tubules, but they also, as I said, inherently have antibacterial properties all over the cavity preparation, nearing the pulp chamber. These provide conditions consecutive for pulp recovery, and therefore the necessity for traditional calcium hydroxide, any other material is not needed. We just want to give the pulp a chance to recover. Plus, these bases, with time, they deteriorate and they leave dead spaces underneath them, okay, which basically attract micro leakage and so forth. Finally, the most important is the placement of composite restoration, which is free from dead spaces, marginal discrepancies, and technical errors. To prevent micro leakage, I want to starve bacteria if they escaped or remained down there. I want to restore anatomy and function and aesthetics. So I inform the patient we may have some transient system for about 4 weeks, then everything will be okay. We should recall the patient in 6 to 12 months to assess, again, using the 4R operational diagnosis system. There should be no pain. You focus on the lamina dura and the periodontal space ligament. It should be normal. No periapical pathology. The patient uses the tooth, and you do pulp test. It should be normal. Finally, you may ask, when vital pulp therapy is unviable, don't do it. I would say number 1 is teeth with the frank pulp exposures. In individuals over 18 years old, teeth with symptomatic irreversible pulpitis, teeth suffering from long-standing chronic pulpitis, teeth manifesting clinical and radiographic sign of a stress pulp. And if you ask what that is, go back to 1982 Journal of Prosthetic Dentistry. Teeth showing radiographic proof of pulp calcification, opacities in the pulp chamber. Teeth with history prior pulp capping, and so on. Finally, I want you to know that my approach is rooted in comprehensive understanding of the dental pulp complex biology, which believes in the dental pulp potentials to recover from injury if given a chance. My treatment approach is that chance. Thank you for listening.